Hi, I'm Dr. Abhishek Patil, consultant rheumatologist. Today we will talk about SLE, a multisystem prototypical autoimmune disorder. Now we call it as multisystem, but truly SLE affects multiple tissues in the body. It's a disease in which your own immune system attacks your body tissues such as joints, skin, hair, mouth, kidney, liver, heart, and in varying combinations. That is why it is called a multisystem autoimmune disorder. Now, there are several reasons why SLE occurs. The most important of them is probably genetic. That's why you see SLE and these group of disorders, whether it is Sjogren's, SLE, rheumatoid arthritis, having some kind of familial clustering. So, about 50% of it, the risk is believed to be genetic in nature. There are various other environmental factors which are responsible for this. For example, ultraviolet rays, various infections are known to trigger attacks of SLE, and that is also associated with the flares of SLE are also associated with tobacco usage. Now, saying that, there is no definite single reason why SLE occurs. There cannot be a food that you can just avoid and get rid of SLE. Generally, you cannot just do one healthy activity and completely get rid of SLE. SLE is a complex interaction between various environmental and genetic factors. To be fortunate, SLE is not that common either. Worldwide prevalence varies between 10 to 60 per lakh population. In India, it is estimated to be 3 to 4 per lakh population. It predominantly affects females in the reproductive age group of 20 to 40 years. So that shows that sex hormones also probably have some roles in manifestation of SLE. Then how does it manifest? How do you know that if probably could have SLE? Well, if you have prolonged unexplained fever, if you have rashes on the face or sun exposed area which remain unexplained for a prolonged period of time, if you have pain and swelling in your joints, which is worst in the morning with significant morning stiffness, if you have some unexplained reason for low hemoglobin, low platelet, low WBC counts persisting for many months, if you have some protein leakage in the urine, well, these are the reasons and prolonged unexplained fatigue. We have seen a lot of young females presenting with significant fatigue, and then the underlying cause being SLE or its sister diseases. That's when we start thinking about stomach connective tissue disease like SLE. Then, as a rheumatologist, how do we get to know that whether you have SLE or not? Well, we do a series of tests after thorough physical examination. For example, we examine your joints to see if there is any joint swelling. We see the distribution of your rashes. We examine your liver and everything through physical examination. We hear your chest, auscultation. We do your heart to see if there's any fluid collection around the heart or lungs. This is supplemented by certain investigations. The routine investigations such as complete blood count, liver functions, kidney functions give a lot of clues to the diagnosis. For example, very active SLE generally tends to have low hemoglobin, low platelet count, low WBC count. They tend to have high inflammatory markers such as ESR. CRP tends to be normal. That's a differentiating factor of lupus and these group of disorders from other similar mimickers such as infections. Then we look at important parameters such as complement levels. These tend to be low in case of active SLE. Then we perform the test, specific immunological test as ANA and anti-dsDNA and several others. But it's important to remember ANA positivity is not equal to SLE. Remember the prevalence I told, 10 to 60 per 1 lakh population? Well, the ANA positivity prevalence is much higher. In low titers, it can be found up to 5% of adult females in low titers. So a large number of people with just positive ANA may not have SLE. This is something which I wanted to stress upon because I hear a lot of concern among the patients. Now this ANA rheumatoid factor unfortunately are being offered as a part of routine health check, which I strongly object to because these are important immunological tests which should be ordered in specific clinical scenarios. And this, however, a strong ANA positivity with constellation of all the symptoms, signs I previously mentioned with low complements help us in suspecting and probably confirming SLE. When in doubt, we also look at biopsies For example, if the skin is involved, we just biopsy it to differentiate from common mimickers such as psoriasis, lichenoid reactions. We also can biopsy the kidney, not just to get to the diagnosis but to know the extent of the severity of the disease. So biopsy also plays a crucial role. And we also do appropriate imaging techniques. As I mentioned about fluid around the heart, lung. So we do chest x-rays, 2D echo, urine routine examination, and several other investigations to confirm the diagnosis of SLE. So SLE, remember, is always a clinical diagnosis aided by certain investigations. There is no single test to confirm the diagnosis of SLE. Now coming to SLE, there is one more important aspect that I want to stress upon. I told you SLE affects females of reproductive age group. These are also the females at childbearing potential. Unfortunately, the SLE tends to be slightly of a severe, severe in nature when it comes to pregnancy, because sex hormones play an important role. However, it is also not true that no SLE woman can ever get pregnant. It's a wrong statement. We had a lot of patients with SLE, me and my colleagues, who, when managed correctly and used pregnancy appropriate medications, there are certain medications like mycophenolate, methotrexate, we cannot use during pregnancy. If we get out of those medications, if we use pregnancy appropriate medications such as hydroxychloroquine, tacrolimus, azathioprine, low dose steroids, and if you ensure that that the disease is at a low state, low disease activity, 6 months prior to conception, majority of the outcome is SLE pregnancy outcomes are good and can be as normal as age appropriate controls. Now coming to management, SLE is a long-term disease. I understand the frustration the patients have to go through, but there are several ways in which if you're suffering from SLE, can make it better for yourself. Proper balanced diet is something goes a long way in. Eat a good amount of proteins, vegetables, and good mix of balanced diet. Drink plenty of water. Exercise regularly. This is very important. So whatever which is good for me is good for patient with SLE. There is no particular food that needs to be avoided. That's something which you need to remember. Tobacco is a strict no. That is something which is known to exacerbate many autoimmune diseases, including SLE. One additional precaution that you should take is, wear full covering hats, use protective clothing so that you don't get exposed to sunlight, because ultraviolet rays are known to trigger an episode of SLE. Now, after this, also SLE requires medications. There are very simple medications such as hydroxychloroquine, which almost all of us use during SLE and continue it for very long period, typically lasting 5 to 10 years. Then, as appropriate, according to the organ involvement, we use a low to moderate dose of steroids. Then there are several immunosuppressives or immunomodulators such as azathioprine, mycophenolate, cyclophosphamide, methotrexate, tacrolimus, cyclosporine, which can be used tailored to the patient's organ involvement and regarding considering their reproductive history. There are newer agents also called biologicals, and which are making a big breakthrough in treatment of SLE, particularly rituximab, belimumab, anifrolumab. A few of them already available with us. A few of them are expected to come to India over the course of time. But all of this can be used to give a better quality of life. So what I want to stress is SLE is a diagnosis which is based on a lot of clinical manifestation, examinations, and investigation combined together. There is no one test you can just simply do and tell that whether you have SLE or not. It has to be through a thorough evaluation by a rheumatologist, and if diagnosed early and managed appropriately, with a shared decision making between the patient and the rheumatologist, then you can have much better outcomes and live a normal, good quality of life. Thank you.